People waiting on non-emergency surgery will soon have a chance to have those procedures done. Tonight, NBC Local 33's Jonah Gilmore details the governor's new order, what surgeries are included, and why some doctor visits still have to wait.
Governor John Bel Edwards is moving forward with allowing some medical offices to open under strict guidelines.
I believe we need to allow people to resume going to the doctor for things that may not be an emergency.
According to the upcoming order, non-emergency medical personnel must equip their offices with PPEs and tools recommended by the CDC.
Each is going to have a plan in place to monitor for COVID-19 symptoms, to test if possible the individuals coming in, to ensure adequate physical distancing between patients. They're going to have a minimum of 5-day supply of PPE available to them, and then they'll have to follow additional guidance that will be outlined in the order.
Under the guidelines, medical procedures will only be performed under 3 conditions.
One is to treat an emergency medical condition. Another is to avoid further harms from an underlying condition or disease. And thirdly, for time-sensitive conditions.
Dr. Guidry with the Department of Health says some procedures have been delayed for 30 days and if not treated, could have a long-term effect.
Thyroid surgery, that could be heart surgery, all those things that we've delayed now for 30 days. If the patient's condition is getting worse, we need to get them in and get those procedures done.
As the state works to meet the threshold required to reopen phase 1 of the state, Governor Edwards says procedures like Botox and other cosmetics will remain on hold.
Where they come in and when that's going to happen, I just can't tell you that today.
Jonah Gilmore, NBC Local 33 News.
That new executive order officially takes effect 1 week from today.